Welcome to the Wildlife Health Talks. This is the 77th episode, introducing WDA members and their amazing work all over the world. I'm your host, Kat Fendel, and today we're heading to Ithaca, New York, though our conversation will take us straight to Southern Africa. My guest, Professor Steve Osofsky, is one of the pioneers of the One Health movement. Back in 2004, he led the drafting of the Manhattan Principles on One World, One Health. For over 30 years, he's been working on one of conservation's most stubborn puzzles. How do you protect wildlife and local farmers' livelihood when the fences designed to keep diseases away from cattle are also killing the wildlife you're trying to save? His work in the Kavango-Zambezi Transfrontier Conservation Area, the world's largest terrestrial conservation landscape, spanning 5 countries, has recently led to a breakthrough that could finally make it possible to take down some of these fences. Welcome to the show, Steve.
Thanks for having me, Kat. Much appreciated.
So I think our audience can tell from the intro, you have been in the One Health business for a long time. So we have a lot of ground to cover. I'm very excited to finally talk to you, and let's get right into it. Well, let's first get into some WDA stuff. When did you join the WDA?
I'm pretty sure it was 1994. I had just finished in Botswana, and Dave Jessup convinced me I had to come to WDA and I had to present some of my work. And he really twisted my arm, which I'm forever thankful for. And whenever I see Dave, I do remind him of that. So that was a great meeting and really one of the first opportunities I had to speak at the meeting. And it was really moving to see the networking. And obviously, I've stayed engaged ever since, and WDA has been an important part of my professional career.
That's awesome. Well done, Dave. Shout out to him. He can be very convincing. I guess you have a lot of fun WDA related experiences. Can you pick one of those for us, like one that's standing out?
Well, honestly, I mean, I really enjoyed Victoria this last meeting. What a wonderful venue, and just great to see colleagues out of the U.S., which was also a good thing at this point in time. So yeah, that was a good experience.
Yeah, very cool. And yeah, Vancouver Island, my first time there. I've always wanted to go, so I love that as well. It was
Yeah,
really
me
cool.
too. Yeah.
Nice.
So I saw those different whales. That was great.
Let's jump into your career path and story a bit. So you trained as a vet and you have spent most of your career at the intersection of wildlife, livestock, and people. At what point did you realize that you wanted to work at that interface rather than just treating individual animals?
Yeah, honestly, I think I went to vet school knowing I wanted to be a wildlife veterinarian. Although early in my career, I really enjoyed hands-on clinical medicine. I enjoyed being a zoo veterinarian, which I was doing at Fossil Rim. And you had a fairly discrete activity in any given day. You got to catch 6 zebra and test them for certain diseases so that they can be shipped to another zoo, something like that. Very discrete, sort of an immediate sense of accomplishment, if you will. But that to me that training was a means to an end. I really wanted to figure out, using veterinary skills, what were the biggest lever arms I could pull to influence conservation in the long term, to influence whether a given landscape was going to be under wildlife or wheat. That's the type of thing that really interested me from the very beginning. But I still grounded what I did in being a hands-on clinical vet, and that was a really important entry point, particularly in Botswana.
You have been described as a biodiplomat. Very cool term. Haven't heard that before. What does diplomacy look like when you're trying to get wildlife officials and livestock officials, who often see each other as the opposition, to sit down together?
Yeah, no, it's an important question. And I think it's something I really didn't think a lot about till I was immersed in it. And it's just, although we're going to talk a lot about Southern Africa and Botswana in particular, I don't think what I'm describing is at all unique to those countries. We see it here in the US as well, where, a lot of ministries or departments are ivory towers or are in their own lanes, and the incentives for collaboration, particularly before we were really talking about One Health, were often not there. And I think if you have a mandate to focus on the livestock sector versus the wildlife sector, you may not again be incentivized to think about the other sector's needs. But what I learned was that you really need to break down those silos and really create engagement and an enabling environment for these different actors to actually recognize that their responsibilities were actually in the same places. They were working in the same landscapes. And so a lot of what I've tried to do through the AHEAD program, which I think we'll talk about, is bring parties together and create a safe zone, if you will, where we could talk about the issues and maybe put some of our partisan hats aside and also break bread. I think until people really know the individuals, not just the job titles across the table, trust is not in place. And a lot of this takes a lot of time because a lot of this is about building trust because people may have different agendas, but the only way we're going to succeed in managing livestock and wildlife together is if neither sector loses. We've got to find those win-win opportunities, and that requires that building a foundation of trust.
Did you find that fun to a certain extent to be a diplomat, or it also sounds like really hard work?
I honestly, I mean, it's a little bit like being the host of a fancy party in many ways. You've got to choreograph, the meeting, the discussions, the meals, and honestly, the field trips. I've done a lot of workshops bringing livestock vets and wildlife vets, for example, together over the years. And particularly, we can get them out in the field and they can look at the problems together and compare notes because they're seeing things through different lenses. And they often, in their own countries, again, including here, if you brought, USDA vets and Department of Interior or National Park Service vets together, they really often don't have a lot of opportunities to compare notes and share the commonalities of the problems that are facing them. So I do enjoy that.
I feel like going out into the field with a whole group, that's the best team building experience anyway, isn't it?
Yeah,
Everyone should
exactly.
actually do
Exactly.
that. You mentioned the AHEAD program. You launched that in 2023. And in simple terms, what problem were you trying to solve? And what does AHEAD actually stand for?
HEAD stands for Animal and Human Health for the Environment and Development. And I started that program. It was around the time, more than 20 years ago when the peace parks or transfrontier conservation area movement was just getting started. And this was an initiative. I remember Nelson Mandela was sort of the head of state who was really chaperoning it in partnership with organizations like the Peace Parks Foundation. And the whole idea was to revisit the idea of connectivity, of restoring wildlife across international boundaries so that, wildebeest in a national park in country A could get to a game reserve in country B. The motivation, in many ways was about poverty alleviation and economic development, which certainly makes sense to me. This was a revisiting of land use priorities. And in a lot of the early meetings that I had gone to about this, it was all wildlife folks. It was people coming from ministries of environment. And I remember being at one of the first meetings and sort of raising my hand in the back. And I said, where's the livestock sector? Because they're the ones who are the deciders, if you will, because a lot of the issues in Southern Africa relate to that interface. And the physical manifestation of that problems at that interface are these vast fences. And the answer I got in the early days is, well, livestock's not our issue. We're working on wildlife and connectivity. And I thought to myself, well, it's going to be your issue. And that's really why I started AHEAD. And we launched it at the IUCN World Parks Congress in Durban, South Africa. And I brought together not just wildlife folks, but agriculturalists, economists, social scientists of other types from mostly Southern and East Africa. And we spent several days brainstorming about these problems and started to recognize that there really were some unanswered questions that were going to require more work in order to really facilitate the type of connectivity that the whole transfrontier conservation area movement ultimately depended upon.
For listeners who haven't been to Southern Africa, including me, can you paint a bit of a picture of what these veterinary cordon fences look like and what happens to wildlife when they encounter them?
Yeah, I mean, if you had a drone and you were flying over these fences run for thousands of kilometers around the region, and so they cut off the most important migrations for most of the species that you think of when you're in southern Africa. And when they're well maintained, they do what they were intended to do. One of the main purposes has been management of foot and mouth disease because the African buffalo is the reservoir of foot and mouth viruses. And going back to the colonial era, particularly the British in a place like what was the British protectorate of Bechuanaland, now Botswana, the colonialists wanted to export beef back to Europe, back to the motherland. But they knew when this started, these fences started to go up really in intensity in the 1950s. They knew they didn't want to accidentally bring foot and mouth in beef back to Europe. As most of our listeners know, if you get foot and mouth in your country, it's an economic disaster in terms of it shutting you out of international trade immediately. And so when these fences were put up, starting in the 1950s, it was a very monosectoral decision in countries like, what was first, German Southwest Africa, and then Southwest Africa under South African auspices, under, in what was British Rhodesia, now Zimbabwe, obviously Bechuanaland, now Botswana. The whole motivation of this was about beef, and wildlife wasn't considered a valuable resource. So since the 1950s, we've had thousands of kilometers of fences being built in post-colonial years, often assisted by the EEC, then the EU, the World Bank. I think USAID probably had a hand in it at some point. A lot of external donor funds went into this, and wildlife was not a priority. But what you had, as these fences went up, migrations were getting cut off. And what I tell our students is we had a slow motion environmental train wreck where hundreds of thousands, probably millions of animals die along these fences because migration is the lifeblood of this region. They need to move seasonally to be able to access grazing, freshwater resources, minerals, and breeding opportunities to maintain long-term ecological viability. So you had really a man-made crisis put in place, to be honest, largely by veterinarians working on the agriculture side. And so here we are, where today, luckily, the whole macroeconomic picture has changed because today, wildlife-based activities, nature-based tourism, etc., contribute as much or more to the gross domestic product of these countries as livestock agriculture. So that economic argument is partly what incentivized the whole concept of peace parks and transfrontier conservation. And it's also created more of an enabling environment to rethink some of the earlier decisions that have led these fences to be so environmentally damaging.
There's also another disease that played a role in this picture, the contagious bovine pleuropneumonia. Do you want
Yeah,
to elaborate
sure.
on that a bit more?
Yeah, it's actually quite important. There are very important fences that are impacting wildlife migrations in the Kavango-Zambezi Transfrontier Conservation Area that are up because of contagious bovine pleural pneumonia, mycoplasma disease. It doesn't affect wildlife; it's a livestock disease. But because different countries have different status in terms of where there have been evidence of CBPP, the fences have been the main way to manage that disease. And so that is another reason that we have this problem. And so you've got to tackle these issues differently depending on what the reason is for a given fence. But what we've been able to do in partnership with the what's called the CASA Secretariat, the official five-nation body that helps facilitate the five countries, Angola, Botswana, Namibia, Zambia, and Zimbabwe, to work together. We've helped facilitate bringing the livestock vets and the wildlife vets from the five countries together under what's called the Animal Health Sub-Working Group. It's an official working group of CASA. And we do what I was saying. We break bread, we go into the field, but we also talk about specific work plans, how to do a better job coordinating surveillance, sharing data, co-planning vaccination campaigns, things like that. The important thing for us as veterinarians to recognize is if you're creating a transfrontier conservation area, you have to recognize that it's one epidemiological unit. The diseases, just like migratory wildlife, don't recognize international borders. And so that issue is actually embedded in the CASA treaty that was signed by the heads of states of those five countries, that disease management had to be something that a burden that the country shared. And so that sharing of responsibility and accountability has helped facilitate the dialogue that we've been in on new ways to manage diseases like foot and mouth that don't necessarily depend on fences.
Building on that, you've championed something called the commodity-based trade, focusing on how beef is processed rather than relying on fences to separate buffalo from cattle. How does that work, and how hard was it to get that accepted internationally?
Yeah, no, I think back to the first AHEAD meeting in 2003, we didn't have that answer. We knew we had to figure out whether there was another way to make beef available for international trade that didn't involve zoning based on fences. And I work very closely with a lot of colleagues in the region. This is definitely a team effort. And one of the most important players was Gavin Thompson, a virologist. He passed away several years ago, and I miss him dearly. But he was really a strategic thinker, sort of an outside the box thinker on these issues. And he also was involved in putting up some of the earliest fences. So we used to joke that his collaboration with us was very much a penance in many ways. But what the whole reason we have fences is because the OIE, now WOAH, manages transboundary animal diseases geographically, meaning you have to have a physical separation from, say, wildlife from livestock. And that's, as you know, WOAH is older than the UN, and all the world's countries essentially are members. And so if WOAH sets the rules, that's what you do. But ironically, in some ways, the international rules that regulate food safety and how to make sure that we ideally don't get sick when we eat a hamburger are under the Codex Alimentarius, which is under the UN, administered by a partnership between WHO and FAO. And in the Codex, it's about value-added processing. It's about the value chain. It's about how the product is produced to make it safe. It's not a zonation issue. And what Gavin and our team started to think about is we've got these two international bureaucracies, one based on zonation, WOAH, one based on the way products are processed to be safe, the Codex. That's really not fair because they're all trying to yield the same goal, which is safe products that don't have dangerous viruses, bacteria, and parasites in them. And so we started to formulate a case that, especially in the developing world, having these two international bureaucracies doing the same thing differently was a significant burden on countries that have to manage these challenges. And we started to look at old science. We didn't invent this science, but old science that really showed us that if you want to make a high quality steak, you're going to, manage your cattle appropriately. Ideally, you're going to quarantine them, you're going to vaccinate them. But then when you slaughter them, you're going to, hang them, at the right temperature for 24 hours below, right above 2 degrees Celsius. And the pH shift is going to go below 6. And if that cow happened to have foot and mouth, that meat would be safe anyway. Then you debone it, you degland it, all these value-added processing things to get a deboned steak at the end. Science already existed that said that meat was safe. But it took Gavin and myself and Mary Lou Penrith from the University of Pretoria and our team more than 10 years to convince WOAH that commodity-based approach should be deemed equivalent to fences. And there was a lot of policy documents that we produced, guidelines on how to actually do the process to make the beef safe. We published this in partnership with SADC, the Southern African Development Community. And in 2015, in partnership with the SADC Livestock Technical Committee, the Inter-African Bureau for Animal Resources, I would say we used a lot of science-based advocacy to convince WOAH to change the FMD chapter, the foot and mouth disease chapter of the Terrestrial Animal Health Code, which was voted on at the World Animal Health Assembly in 2015. And all the world's chief veterinarians voted yes. And so the Terrestrial Animal Health Code changed, which for the first time in generations meant that if you were a poor farmer in Southern Africa and Northern Botswana, for example, living near wildlife, if you followed these fairly basic procedures, you could theoretically access markets that had not been open to your great-parent, your grandparents, or your great-grandparents. So this was really the break that we needed to start to get people to rethink the modalities that were available to produce safe beef, but that in this case could unlock opportunities related to the wildlife economy, which, as I mentioned today, is actually more important economically to at the national and regional level than livestock. Although, to be clear, we need both. We need, resilient livelihoods basket. We need people to have their livestock, and we need wildlife and tourism and the opportunities that provides. We're not, we're never picking sides. We're trying to find, again, that win-win. And so commodity-based trade was sort of the approach that allowed people to, for the first time in more than 70 years, rethink the fencing paradigm.
At the beginning of the interview, we talked about you being a biodiplomat. I definitely get the picture much better now. Like, wow, how much talking was involved there? That is incredible. It sounds to me like there are, let's say, many approaches to the issue. So your paper, one of your many papers, also mentioned herding as a viable alternative to fences. What does strategic herding involve?
Right. So, I mean, we're going to compress a lot of history into a short time. But once we had the idea of commodity-based trade of beef and this non-fence-based way, we still needed to work with the relevant governments to make sure that everyone was comfortable with this, both on the production side in places like Botswana and Namibia, who've taken a leadership role on the beef side, but also in the buying side of markets. And one of the things we did is we did an analysis of all the fences in the Kavango-Zambezi Peace Park. We did this during the pandemic. We did colleagues we had in the field looking at animal tracks and looking at where animals were getting hung up on the fences. We collected data going back historically, and we looked at all that was known about which fences are most important to blocking migrations. So using that data, we identified the most important pinch points, some of which are hundreds of kilometers long. And then we were able to enter the next phase of the analysis, which was ask the really important question: what would it mean to disease control if those sections of fences that are most damaging to wildlife were no longer there? And that's a tough question. And what we had to do was look at the fences as they are versus the hypothetical if they weren't there at all. And the important thing is, since the colonial era, the fences have become a really expensive burden because this is an area with the highest, it's the largest population, it's the majority of Africa's elephants live in this part of the world. And elephants damage fences constantly. As floods damage fences, people damage fences. And the fences are not, they're semi-permeable in many places now. So they're not really pristine. And so what that means is their role in mitigating disease risk is not what the lines on the map might imply. And so, to make a long story short, we were able to do a qualitative risk assessment, which is the new paper that just came out last month that you're referring to show that epidemiologically speaking, whether you're looking at, for example, foot and mouth or contagious bovine pleural pneumonia, the level of risk of those diseases crossing from one country to another is the same, whether the fences that we're talking about are there or not. Now, that's a hard thing to demonstrate, but I think we did a really robust job. And then the herding comes in because we really wanted to make sure that particularly the communities involved, the government partners were confident that they were really going to be able to manage disease risk. Well, it turns out that whether the fences are in good shape or not, the most important thing you can do to protect livestock from these diseases is to herd them. And the history in this region is that herding has lost its way, I mean, so to speak. Most communities are in like northern Botswana are not herding their cattle all the time. They're not tending their cattle in a meticulous way. So if you don't herd your cattle, they're going to wander around. They're going to overgraze certain areas. They're certainly more likely to come into contact with wildlife like buffalo, which increases disease risk. They're going to be more prone to be eaten by lions. They're going to be more prone to be stolen. When it's time to have vaccine campaigns, which the government hosts, if you don't know where your cattle are, they're not going to get vaccinated. So if you start to herd your cattle, all these boxes get checked. The cattle get tagged. You know where they are. You have traceability. They show up for vaccines. They're not getting eaten by lions. They're not catching diseases. And you can see them every day. And we are training professional herders in partnership with a number of great NGOs and making herding basically returning it to a profession that has some prestige where people value herding. And at the same time, there's this incredible virtuous cycle going on where the safari operators in a place like northern Botswana, they want this to happen. They want communities to be better off, and they don't want communities going out and killing lions because the lions have taken their cattle. So they want to encourage all of these procedures. So they're paying farmers who participate in what we're calling wildlife-friendly beef production a premium. So if you as a farmer, you sign up for this, you agree to herd, you follow all the criteria that are laid out, and they're not complicated. They're fairly common sense. But if you participate, you will get more, per kilo for your cattle than you would have otherwise. And it's a win-win-win because the livestock sector benefits. If the governments are convinced over the next 5 years that all the communities are now herding, they will hopefully really start to take down some of these most damaging fences. And at the same time, the wildlife resource will be able to maintain itself. If we don't take down these fences, I want to be clear, the long-term trajectories for most of the populations of wildlife that we're talking about are not good. They are as spectacular as Southern Africa still is. Wildlife populations, for the most part, have declined largely because of habitat fragmentation and encroachment by human settlement and livestock. And the corridors that we're talking about across the 5-nation Peace Park, we've got to restore them because we want wildlife to be there in 50, 100, or 250 years because it has value for its own sake, but also because of the value it has to economic development and lifting people out of poverty.
Very impressive. I was just thinking when you talked about the development and how now people are encouraged to do herding again, I can imagine that this must be a whole social effort as well, because I guess at some point people were probably also relieved that they didn't have to do all the herding anymore. I mean, it's way less work, right?
I mean, it's partly related to history. Using Botswana as an example, before independence in the 1960s, kids didn't go to primary school, and it was largely children who herded. And it was a good thing when Botswana became independent that primary school became mandatory, but that did change the labor force, if you will. And so that definitely impacted sort of the herding culture. But I think when we just did a community survey across Botswana's Eastern Panhandle in partnership with our colleagues in EcoExist and Claws and other NGOs. We wanted to talk to farmers, village elders, chiefs, and when we kicked this off, I remember we had a meeting with the chiefs of the 14 villages, and they recognized that things had changed, that the loss of herding was a problem. But honestly, because they weren't getting good value for their beef, nobody would buy beef from farmers who live near wildlife. There was no incentive to herd. But now that the markets are changing, things like this wildlife friendly beef and the incentives that, for example, tourism operators are offering, and when they buy beef to feed their own staffs, which is a sizable number of people in northern Botswana, the economic calculus changes. Farmers make logical decisions. And if they can actually improve their incomes by participating in the herding, a lot of them are going to choose to do it. So it's just like any business person, you've got to figure out if this is a viable enterprise. And one of the things we've noticed in the first communities that have adopted this, one of the most obvious things that happens is we've had one community where lion takes of livestock have gone from something like 20% of the herd annually to zero. That's a huge loss if you're a farmer. You can't make a living if you lose 20% or more of your cattle to lions. Now that the herding's going on, there's been no losses. Lions aren't getting killed. And those are the farmers who are starting to get a premium for their beef. So there's a lot of economics to this that gives people incentives to participate.
Very cool. Thanks for explaining that more. Unfortunately, we have to wrap up. This is a huge story. We could talk about this for hours, and I wish we had that time because it's very fascinating to listen to you. But let's wrap it up with a outlook question. After more than 30 years working on that, and this is going all the way back to your time as the first wildlife veterinary officer for the Botswana Department of Wildlife and National Parks in the early 1990s. So very long history there. The question is, are you optimistic? And are we going to see fences come down and wildlife corridors reopen?
Well, I first got to Botswana in 1991, and I had more hair. But I would say over the years, I've seen incremental progress to a degree that does give me hope. I mean, honestly, real change takes real time. And this is something that often donors don't appreciate. We work with grant cycles that may be 1, 3, or 5 years if we're lucky. But what you're talking about land use policy and cultural paradigms that you just can't flip in a short time frame. A lot of my colleagues think I'm nuts, a little bit like Don Quixote chasing windmills. But honestly, I'm seeing uptake of this by my colleagues in the region, the departments of veterinary services, the wildlife departments, because as I said, this really is a win-win. People are recognizing that they need livestock, they need wildlife, and if we don't solve this problem, both sectors are going to continue to suffer. People are not going to be able to access markets for their beef. Wildlife migrations are not going to be restored, and the visions for peace parks, for transfrontier conservation areas will ultimately fail. So there are a lot of incentives working in our favor right now. So I am cautiously optimistic that in the next 5 years or so, if we continue to see progress with uptake of herding, which we are seeing, and if we continue to get support, which I also think we will, I think we might see the first major fence be removed, hopefully within 5 or 6 years. And I think all we need is proof of concept for people to have more comfort that this is the right direction. And, it's a very science-based program, and it's very much based on, working with government partners and community consultation. The communities, the farmers, they have to be on board. So give me another 5 or 10 years and we'll do this again.
That sounds great. Looking forward to that. Well, thank you so much, Steve. And I love I asked this question in the end if you're optimistic, but I could tell from the whole conversation how passionate you still are after all this time about it, after being in diplomacy for so long. I feel like not everyone can say that they still have that energy and optimism. So that's really cool and inspiring. So thank you so much for sharing your incredible story and this important work with us, Steve.
Thanks for the opportunity. Take care.
Thanks for listening to the Wildlife Health Talks. We will be back with a new story in 2 weeks. Bye for now.